you think of the worst sometimes, but we had all the ladies there, so my brain went from one extreme to another. And I think, obviously I was educated about the birth, but once that comes, anxiety kicks in and you get all this adrenaline, you're just like, ah. So in the end it was okay, but obviously the thought process go as they go.
My first boy, who's 5 now, he came as an emergency cesarean. My wife ended up having to be induced at first. Being induced didn't work for the first couple of times, so she ended up on a hormone drip, which not really nice to look at. My wife being in a lot of pain, trying to go through childbirth with minimal pain relief, just gassing her, and then for your wife to be told that she's only 2 centimetres after being in labour for about 12 hours, broke her heart. So she ended up going for more medications for the pain. There's not a lot you can do as a husband apart from be there to hold hands, comfort, make drink, things like that.
Because it was an operation, took away from it a little bit. I was just there with Lucy's on this side, up near her head. But there was that many people in the room, and it was just pretty, not chaotic, but for me it was just like impersonal.
When you're in the room and you're with the nurses and things, and all the beepers are going off and you're surrounded by monitors that you don't understand, people are talking in codified language that doesn't make any sense, and they're referring to numbers and terms that you've never heard of before, and people get really caught up in the emotion. They're seeing the partner in pain, they just want that to stop because they've never seen it before. It can be very overwhelming for some people and everything.
Didn't know what to say all the time for the 19 hours she was in labour. There's only so much things you can say over and over again when it gets a bit, oh, you're just saying that now type of thing. I think there should be more help for fathers when they're in labour, what to do and how to do things. Also, how to help your wife or your partner at the time through it all.
You kind of recognise that as much as you want to help and as much as that you want to support, you are there as an important, but you're a bit part player, because there are some things that you can't do. You obviously can't deliver the baby yourself. The medical professionals aren't treating you, so their focus is always going to be on mum. So that can be a bit daunting. That can take a bit of getting used to, because you can feel a bit like the third wheel. You can feel a bit like you're detached from what's going on. You can't really influence things.
The first couple of days at the hospital, I don't think the nurses meant to, but they seem to say if they come in on checks, they'd take him off me and back to Sarah, and sort of when they was talking, they'd be looking at the mother, and sort of it almost felt like they were blanking me out, but obviously they were a big part of it and whatnot, and listen and take on the information given still.
You're trying to take it all in and enjoy it and everything, because it's such a special occasion and everything. But it's nerve-wracking as well and everything. I think it's pretty normal, really, isn't it?
I did feel a bit excluded, but it's important to obviously listen, because 2 memories are better to remember what's been said and whatnot.
And I think it's really easy to let it get the better of you. I think if I had any advice for anybody, it would just be to sort of like to read the room, look at what the nurses and those guys are doing, and just try and take it from them and think, if they look like they're relaxed and everything, then things are under control. Just go with it and let them sort it. They'll be fine in the end.